Buoy Health Insights, Cold Skin. Hello and welcome to today's episode of Buoy Health Insights, where we uncover the facts about different health conditions that could be affecting you. If you've ever experienced cold, clammy skin, you're probably familiar with that uncomfortable sensation. But what does it mean when you have cold skin? Today, we're diving into the potential causes of this condition, what other symptoms may indicate, and when to seek medical attention. Firstly, it's essential to know that normal core body temperature is around 98.6 degrees Fahrenheit. If your skin feels unusually cold, it could simply be due to being out in the cold too long. However, if you find that you're sensitive to cold or you're experiencing cold skin along with other symptoms, it could point to a health issue like hypothyroidism, Raynaud's syndrome, low blood sugar, or a blocked artery. Let's explore some of these causes further. Hypoglycemia, or low blood sugar, is a condition that can lead to cold skin. If you can't check your glucose levels but suspect low blood sugar, consider eating high-sugar foods like juice or a candy bar to help manage the immediate symptoms. It's important to keep a close eye on your blood sugar, as levels can temporarily rise and then drop again. Severe or ongoing symptoms might require injections or IV medications. Peripheral arterial disease, PAD, is another cause, characterized by a buildup of fat inside the arteries of your legs, which narrows them and makes it harder for blood to reach the lower legs. It most commonly affects people over 65 and smokers, as well as those with diabetes, high blood pressure, high cholesterol, or a history of heart attack or stroke. Symptoms of PAD include cold feet, calf pain with exercise, hair loss on lower legs, and slow wound healing on legs or feet, among others. Severe cases with complete blood vessel blockage are medical emergencies requiring immediate attention. Frostbite occurs when extreme cold causes skin and underlying tissue to freeze, which can happen even if you're wearing protective gear in very cold temperatures or if you become wet. First, the skin feels cold, then numb. If the condition progresses, tissues may become black and die. In severe cases, treatment involves rewarming the skin through warm water or whirlpool treatments and possibly surgery to remove dead tissue. Hypothermia, on the other hand, occurs when your core body temperature drops below 95 due to prolonged exposure to very cold temperatures, which can lead to confusion or loss of consciousness. It requires immediate medical treatment, including warming methods and possible hospitalization to monitor for complications. If you experience cold skin along with symptoms such as fatigue, weight gain, hair loss, or constipation, it could suggest a thyroid issue. Cold skin that doesn't improve after warming up, blistering skin, fever, and persistent shivering or body-wide coldness that doesn't resolve may also necessitate medical attention. Now, when should you actually seek medical care for cold skin? Contact your doctor if you experience cold, discolored, or numb hands upon exposure to cold intolerance, or cold skin, along with other concerning symptoms, episodes of low blood sugar unmanageable at home, calf pain that diminishes with rest. Should you go to the ER? Yes, if you have been exposed to cold temperatures and can't get warm. Severe pain, cold skin, color change, and numbness in your hand or foot unrelated to cold exposure. Unusual resting heart rate, either too fast, over 100 beats per minute, or too slow, under 60 beats per minute. Altered alertness, difficulty staying awake, or tracking a conversation. Dizziness, low blood sugar that doesn't improve after consuming something sugary. In summary, while cold skin can sometimes be a benign condition, it may also be the sign of a more serious medical issue. It's important to monitor your symptoms closely, understand the potential underlying causes, and know when to seek medical care. At-home care tips for those with cold skin include going inside and removing wet clothing, putting on warm clothes or blankets, drinking warm liquids. For people with diabetes, eating regular meals, taking medications as directed, and monitoring blood glucose levels. And remember, folks, knowledge is your best defense when it comes to your health, so stay informed and take action when necessary. If you found this information helpful, please give us a thumbs up and don't forget to subscribe for more health insights. Until next time, take care and stay warm.